And a very good evening to you. I am Lisa Lord, and on this program, we will focus on the hard work being done at the Heart and Stroke Foundation of Barbados, Inc. as Barbados battles an alarming high rate of heart attacks and strokes in a very small population. Now, my very first guest is interventional cardiologist and medical director of the Cardiac Disease Prevention and Rehabilitation Program here at the foundation, Dr. Dawn Scantlebury. Dr. Scantlebury, thank you so much for taking some time out of your busy schedule to join us today.
My pleasure, Lisa.
Now, just a few weeks ago, you were quoted in the media as saying that heart disease is a huge problem in Barbados. So let's dissect heart disease, starting with some of the obvious symptoms.
Let's talk a little bit about the different types of conditions. So everybody knows about a heart attack. And, you hear about the Hollywood heart attack where you see an elderly man or middle-aged man clutching his chest. A heart attack occurs because of a blocked blood vessel causing damage to the heart muscle. And some of the common symptoms include chest pain, sudden onset chest pain, and shortness of breath, associated sometimes with sweating or lightheadedness, nausea. More commonly in women, you may get shortness of breath on its own and not the chest pain, or sometimes just a feeling of feeling very unwell without that chest pain. That's heart attack pain. Now, if someone has chest pain like that, my recommendation is to seek medical attention as soon as possible. And I'm just getting that out of the way. And you'll probably hear me say that multiple times. If you have a heart attack, go to the hospital or the emergency room immediately. Time is muscle. Heart failure is a condition where the heart muscle is weakened, or it can be, and the heart can become enlarged. And symptoms of heart failure, again, include things like shortness of breath, leg swelling, difficulty lying down flat, again, because of that shortness of breath, and just not having that get up and go that you used to have. Arrhythmias or abnormal heart rhythms, a problem with the electrical activity of the heart. Patients may present with palpitations. So palpitations is essentially just an uncomfortable feel of your heart beating. It can be beating quickly, it can be skipping a beat, it can be doing a little flutter and stopping. That's what a palpitation is, and it can be associated with shortness of breath sometimes, or lightheadedness, dizziness, fainting. And the most ominous and severe cause of or symptom associated with an arrhythmia is actually sudden cardiac death, which leads to death if it's unresuscitated. We can call it a symptom if you're able to resuscitate that patient with CPR and defibrillation. And so those would be some of the most common symptoms that I would see coming to me as a cardiologist. There's a lot of cardiac disease that's relatively silent as well.
Yes.
It still is important to pay attention to risk factors and screening in appropriate conditions.
How major of an issue are you seeing in terms of having an enlarged heart?
Enlargement of the heart can occur from a variety of conditions. So in Barbados, hypertension is a big problem. And what happens as the heart tries to squeeze against that high blood pressure, the walls of the heart become hypertrophied or thickened, just like how your muscles in the arms get thick. The heart muscle gets thick when it's trying to overcome that. And that thickening leads to enlargement of the heart. You can also get weakening of the heart muscle for various reasons. Hypertension, again, blockages in the blood vessels causing heart attacks. Other viruses such as COVID and other viruses like flu and other things can lead to enlargement of the heart muscle. And then there are genetic causes as well. And these can lead to dilation of the chambers of the heart. And you can get actually quite massive enlargement of the heart because of that. The end result of that is, again, heart failure symptoms with shortness of breath and leg swelling and fluid retention.
Now, from time to time, if you exert yourself, you might get a little chest pain. And sometimes people do tend to ignore a pain in the chest.
If you are exerting yourself and getting chest pain on a regular basis, that's something that needs to be investigated. especially if you are of a certain age, well, anything higher than middle age with risk factors such as diabetes or high cholesterol or hypertension. If you're getting chest discomfort with exertion and you didn't use that as a child, perhaps you should get that sorted out. I think sometimes, if thinking back to PE in school.
Yes, that's why I asked.
If you were doing a lot,
yes,
like really, really running flat out, sometimes you may get that little chest tightness or whatever, maybe a stitch in your side or something like that. That you could expect if you're really going flat out. But if you were accustomed to doing a certain degree of exertion and you find that out of the blue, or this is something creeping up that suddenly you can't walk that mile. At the end of half of a mile, you're starting to feel a little bit of chest tightness or chest pressure or jaw pressure or throat pain or pain in the upper back. All of these things are part and parcel of that whole anginal complex or chest pain complex.
Jaw pressure.
Jaw pain, yeah. Jaw pain on exertion, that goes away with rest, should prompt a consideration for heart disease.
Okay.
So sometimes you hear about patients or people who have a heart attack, they have chest pain and the pain radiates up to the jaw. It can radiate to the shoulder, to the arms.
Yeah.
Exactly. Sometimes they can get that same pain in the shoulder or arms without the central chest pain.
And I've heard older people saying, they might have gas and it feels as though it's lifting their heart. I'm sure you would have heard a lot of things over the years as a cardiologist.
Yeah, you hear a lot. You hear a lot of people who try to self-medicate their heart attack with ginger tea because it wasn't a heart attack, it had to have been gas. So they drink their ginger tea and then they, unfortunately, when they finally get to medical attention, that heart attack has already destroyed much of their heart muscle. So people need to be aware, because a lot of the time, there is this consideration or this thought that, well, it's just gas and it's going to go away. But if you were aware that that sudden onset pain at the top of your abdomen or in the pit of your stomach or lower chest pain, that's associated with a little bit of shortness of breath or sweating, and it's not something you're accustomed to getting. If you were aware of that, you would go to medical attention, or you should. Sometimes some people think that they're having a heart attack and stay at home too, but remember, time is muscle.
But let's talk about how much time do you have? I'm talking about from a mild heart attack to a very severe heart attack in terms of getting to medical care.
So, as I said, a heart attack is where you get a sudden block in one of the blood vessels supplying the muscle of the heart. So depending on the size of the blood vessel, that's what actually dictates the severity of the heart attack and how much muscle is impacted. And then as time goes by, so if for instance, like I had a patient once who was on River Road when he had his heart attack. He had sudden onset, severe chest pain. And he said, well, this pain was so severe, within 15 minutes, he was in the emergency room and getting his medication to open up his blood vessel.
But he was right there.
He was right there. So even though it was a severe or a very, very significant blood vessel, he ended up not having a lot of damage because he got to medical attention immediately. On the other hand, if he were in St. Lucie and thought it was gas and drank ginger tea and stuck around for a half an hour to 45 minutes, 2 hours, 3 hours, by the time he got to a hospital, he may have had significant irreversible damage and then ended up with the heart failure symptoms. So I said all that to say that some of it depends on where the heart attack is, and then, of course, the duration of symptoms. So when a patient comes to us having had heart attack symptoms, if you're able to get that blood vessel opened within 2 to 3 hours, we know that your outcome is going to be best. beyond 3 hours, we know that there is going to be some consequence. You are going to get significant damage. After 12 hours, a lot of the time that heart damage is irreversible, depending on there are a lot of different situations. The body sometimes tries to break down that clot. So you get the situation where someone may get chest pain, and then it goes away, then it comes back, and it goes away because the body is trying to fix it. But it's this stuttering type heart attack. So every single patient is different. The key and the message that I'm trying to get across is, as soon as there's this thought in your mind that you're having a heart attack, you need to come to the emergency room, because we are trying to get that blood vessel open within a short period of time to reduce all the long-term complications of heart attacks.
Well, let's go back a little bit and look at heart health.
Mm-hmm.
There are various tests that you do to diagnose a patient with a particular heart disease.
Mm-hmm.
Take me through some of the tests.
So let's go back to the heart attack. So if you come into the emergency room, the first thing that we do, well, beyond take your vitals, blood pressure, etc., would be an electrocardiogram. That looks at the electrical activity of the heart, which changes depending on what's going on in the heart. So there's a specific pattern that we look at on the ECG for a heart attack. If you have hypertension and you have periodically your doctor should really do an ECG to make sure that you're not having in that same enlargement of the heart that we spoke about. That manifests in a certain way on the ECG as well. And it could help you if you do have evidence of enlargement of the heart. It could prompt you to be a lot more aggressive with your blood pressure management or blood pressure control than you were before. So ECG is almost like our fourth or fifth vital sign in cardiology. If you come to me as a cardiologist for the first time, I'm going to do the ECG. That's just one of the things that we're going to do, because it gives us so much information about what's going on in the heart. Other things that we do, there's something called an echocardiogram. That's an ultrasound of the heart. Gives us a ton of information, tells us what the structure of the heart looks like, what the walls are doing. Are they contracting well? Are they relaxing well? We look at the valves. Are they closing appropriately? Are they opening appropriately? All the different structures in the heart we see on echocardiogram. A stress test, so there are different types of stress tests. A simple treadmill stress ECG is a test where we hook you up to an ECG and we put you on a treadmill. And every second, we're monitoring that ECG as you increase your exercise. So it's a graded exercise test. You start out at one level, one incline, and every few minutes it increases in speed and in the incline or the grade. And we look to see if there are changes suggesting that the heart feels like it's under strain. So obviously, if we think you're having a heart attack, we're not putting you on a treadmill.
Yes.
But if you are having that chest pain on exertion, we may need to do a stress test to see if that chest pain is actually related to your heart. There are different types of stress tests as well. There's stress echo, there are nuclear type stress tests, and stress MRI. And then there are other ways that we can look at the heart as well. CAT scan, we can look at the coronary arteries, and we can look at the actual structure of the heart. Cardiac MR or magnetic resonance is another way of looking at the structure of the heart.
Now that you mentioned stress, it's not the stress in the traditional sense that we think of being under pressure from work, home, whatever the case may be. Is stress, the stress that we know, a major factor in heart attacks?
Stress, when you look at the statistics and you do all your statistical analysis and account for this and account for that, stress itself is not necessarily a direct cause of heart disease. Well, there's a few specific heart problems that it can cause, but say like the typical heart attack, how the stress leads to that heart attack is typically through things like abnormal lifestyle or maladaptive lifestyles where you come home late from work, you eat the first thing that comes to hand, or you stop off at the nearest fast food restaurant. You don't put the time into exercise, so you get overweight, your cholesterol goes up, you develop blood pressure, high blood pressure, you develop high cholesterol. And then those act together to lead to cholesterol plaques being laid down in the blood vessels and heart disease. Stress. So stress is associated with obesity, with sedentary lifestyle, with overeating, etc., and that's or smoking, with substance abuse. So a lot of those are the ways that stress will lead to heart disease. Stress can also, again, going back to that person who comes home late and then has to get up early and go back to work. Sometimes their sleep patterns are impaired, and more, and all the research is there. Sleep and impaired sleep is actually a direct risk factor for heart disease as well. It's now being counted as one of those top risk factors.
So let's look at the risk factors. You mentioned lack of sleep being in there now, hypertension, high cholesterol, that's 3.
Diabetes, smoking, sedentary lifestyle or decreased physical activity. Well, I'm looking at that from the point of view of the things that you should do to decrease your risk of heart disease. When we talk about the top 5 risk factors for heart disease are smoking, hypertension, high cholesterol, diabetes, and family history, right? But then the things that you can modify, you can't change your family history, but you can be more physically active. And we know that decreased physical activity is associated with it. Unhealthy weight. So if you're overweight or obese, you have an increased risk of heart disease. And then unhealthy diet. So not necessarily a diet that is, or not necessarily if you're overweight or obese, you could still be a normal weight, but if your diet is very unhealthy, you could have an increased risk for heart disease as well. So I think I went over 8 there. Yeah.
That's fine. We want all of them. No, you mentioned stats, since we're on stats. Back in June, Pro Vice Chancellor and Principal of the University of the West Indies Cave Hill campus, Professor Clive Landis, revealed that Barbados was recording an average about 10 heart attacks a week. How is that possible in little Barbados?
Yeah. So, and I would add that represents a significant increase in the last few years as well. Our obesity numbers are going up. People are taking less public transport. There are more fast food restaurants in Barbados sometimes, I feel, than churches. Probably not. Somebody should look at that. But we are having, there's just this epidemic of unhealthy lifestyle in Barbados. Or environment is just this obesogenic environment where the emphasis is not on physical activity. The emphasis is not on eating fruits and vegetables. You know, you turn on your radio or you turn on the TV, there's the ad for a fast food restaurant or the sugary drink or this unhealthy snack. So I think that more than anything is what's contributing towards our increase in heart disease. We may want to blame stress, but I would posit that our forefathers probably had just as much stress as we did. Our forefathers who were slaves, and then as slavery ended and they were working in the plantations and life was hard. But what were they doing? They were working in the fields and had a lot of physical activity. Of course, unfortunately, healthcare systems weren't what they are now. So they died from other things. They died from the infections and the pandemics, etc. So that was the age of pandemics. Funny I'm saying that when we're now coming out from a major pandemic. But pandemics is what took care of our forefathers, but they weren't dying from the heart disease. We're dying from heart disease now because we're not out working in the fields. We're not
sweating.
Yeah, and we're not eating from the earth. We're eating highly processed foods and getting in our cars and driving to work, and then at the end of the day going back home.
Of those 10 strokes a week, how many of those patients do we lose?
I am going to go to my data here.
Please.
Got it right here. Um, so the strokes,
Heart attack.
heart attacks. So, or I can tell you that off the top of my head. So in 2019, our case fatality rate for heart attack was 25% at the hospital. So when we look at the overall heart attacks, the data from the BNR, the Barbados National Register of NCDs, looks at people who are admitted to hospital. So about 2/3 end up being admitted to hospital, and then the rest of them are death certificate or people who've died at home or have sudden cardiac death, and the presumption is, or an autopsy reveals that they died from a heart attack. So the 350 or so who are admitted to hospital, the about 25% died in 2019, and that's the most recent published data from the BNR. So 1 out of 4 people who have a heart attack will die. Well, will die on that within soon after that, and then
because of the damage done to the heart.
But then out for a year, if you look out a year, that 25% doesn't include people who die beyond the first 30 days or so, and then who end up having the heart failure because of the damage and ultimately die within the next year or so.
Professor Landis also revealed that the island was recording about 2 strokes a day or about 14 strokes a week. And that figure is, it's confusing.
It blows the mind. It just blows your mind. Same risk factors: cardiovascular disease, heart and blood vessel disease. So if you think of a heart attack, think of a stroke as a brain attack. So it's the same process, a blocked blood vessel, or in some instances, in about 20% of cases, a bleed into the brain. But the vast majority of those strokes are going to be a blocked blood vessel in the brain. Same process that happens in the heart for a heart attack. Same risk factors: hypertension, diabetes, high cholesterol, unhealthy lifestyles. So I honestly think we probably get a lot more heart attacks than are actually diagnosed. As a cardiologist, one of the things that we find is, as we're testing people and we do echoes, etc., we see these abnormalities in the heart muscle that when you ask the patient, "Well, I didn't have a heart attack," but you look at the echo, you had a heart attack.
A mini heart attack.
Yeah, you just didn't know about it. Sometimes it's a fairly large heart attack and it was silent.
How is that possible?
If you go back to the wide range of symptoms I gave you at the beginning for heart attacks, there are just some things that people will ignore. Because if you just felt wretched, like you get up in the middle of the night, you feel really, really, really bad, and it continues for a good few hours. Some people will just ignore that and, get up and pace or something. And sometimes that was a heart attack. Yeah.
Let's look at the symptoms for strokes.
Right. So coming back around to stroke. And I think that's probably one of the reasons why strokes are probably more diagnosed than heart attacks, because a stroke is often not silent. So we talk about fast. So if your face is twisted and your arm is weak, when you're having difficulty speaking, that's the S, it's time to seek medical attention immediately. So FASD. So facial asymmetry, where you smile and one side of your face goes up and the other one is drooping. Weakness of any limb. So it doesn't necessarily need to be your arm. It could be the leg or an entire side. If there's difficulty actually getting the motor function of speech, so slurring of the speech, or actually not being able to come up with a sentence or being able to understand what other people are saying. Those are all signs of strokes. There are other less commonly described signs of stroke, so being off balance, or their vision problems, where all of a sudden you go blind in one eye or a blind in one part of your visual field.
I've heard about some severe headaches as well.
Yeah, severe headaches, especially if it's a bleed into the brain. So again, just like the heart attack, where time is muscle in the brain, as far as strokes are concerned, time is brain, or time is brain tissue. So we have a protocol in the emergency room in the Queen Elizabeth Hospital for opening up the blood vessel of a patient presenting with a stroke. But whereas with a heart attack, at least we look at um, onset of symptoms out to 12 hours after onset. For stroke is a lot shorter, and 3 hours tends to be the cutoff time. Again, I'm not a neurologist. I think in some instances they're stretching that a little, but 3 hours is what sticks in my head. So if you have sudden difficulty speaking, sudden difficulty seeing or walking, it's like, get to the hospital immediately, because they're going to need to get that CAT scan and look at your head and decide if you're a candidate for thrombolytic therapy. Thrombolytic is clot dissolving agents.
Since we're looking at strokes, my grandfather, who's now deceased, he would have had 2 massive strokes in his 60s, survived, had severe mobility issues afterwards. We're having people in their 30s having 1 severe stroke, and they are not surviving. What has changed?
I would say the unfortunate thing for that person in their 30s who died from a stroke is that they probably just had really bad luck. Or your grandfather had good luck. So just like I was describing what is a stroke is damage to an area of your heart. So it all depends on what area of your heart is involved and how large that area is. So if you have a stroke involving part of the centers of your brain that regulate breathing or your heart or something like that, you're not going to survive that. Or if you have a stroke that is large enough that's associated with a lot of swelling of brain tissue and the pressure inside your brain goes up, that could also be fatal. On the other hand, say your grandfather had a stroke that affected part of his brain that was is very, very visible as far as symptoms. Perhaps one side of his body went dead, but either it wasn't in an area that was so critical that he that he wasn't that he died soon after, or he had very good recovery and very quick recovery. Because going back to, remember when I was talking about this stuttering heart attack where the body tries to break down that clot? Same thing will happen in the brain. So someone may come in with a heart attack, not a brain attack, a stroke. There's a clot inside that blood vessel. The body is going to jump in, and your intrinsic pathways that are trying to break down clot are going to jump in and try to break down that clot and open up that area. So you may be left with damage, but ultimately that damage may not be as significant as, say, that young person who had an even more critical area.
I guess what I'm getting at is that, are we recording more severe strokes than 20 years ago, or is it a case that our bodies have become weaker?
Oh, good question. So we are, I have to say that I can't say that the strokes are necessarily any more severe. There is always going to be a wide range of strokes. But if you have this wide range of 10 strokes, if you are having 10 strokes and you have this range, it's not going to seem as bad as if you're having 100 strokes. You're going to have a lot more of those really more severe strokes. So if number 10 is the most severe, and before you only had 1 severe stroke, if you're having so many more strokes, you're going to have more of those severe strokes just by virtue of probabilities. And our stroke numbers are increasing as time goes by. And again, we've always had a situation where relatively young people can get strokes all the way up to older people. It's been more in the older people. And if my studying of this most recent BNR data is correct, when you look at the age ranges, that shift in the numbers of strokes and per age group is actually coming the wrong direction.
Which was going to be my next question. On record, what is the age of the youngest person that we've had on record? Heart attack or stroke?
I couldn't tell you that, actually. I don't know. I know even babies can get strokes,
Yeah.
actually. Even babies can get strokes or heart attacks. It all depends on what the issue is. So if you have a clot in one of your heart chambers from one condition or the other, that can go to the brain and cause a stroke. So sickler's patients, that's the wrong term, people who have sickle
Sickle
cell
cell.
disease are at increased risk for stroke. And that's not a lifestyle issue, that's a genetic issue. And it's not something that, eating bacon or whatever did anything to. That's just their intrinsic risk for stroke.
No, I heard you mention bacon, but I'll grill you on that later. No pun intended. However,
No.
however, we know of cases where people do everything right.
Mhm.
They eat correctly,
Mhm.
they are very fit,
Mhm.
but they still end up with a stroke or a heart attack.
Mhm. Yeah. So when atherosclerosis, that's the cholesterol plaque that's laid down in the blood vessels, starts, early. When you go back to the Korean War, and then these are things that people, this is when this was first recognized. 18-year-olds or 17-year-olds who died in war for one reason, when they did postmortems and they looked at their blood vessels, they saw that early sign of cholesterol plaque. We're talking about 17-year-olds. And isn't that they were any more unhealthy than the average person? These were soldiers, so they were very, very
Fit, yeah.
physically active, etc. So cardiovascular disease is a degenerative process. Our bodies are not perfect. They break down,
Yeah.
and that degeneration starts from the time you're born, essentially. So when we speak about risk factors for heart disease, we're speaking about risk factors for accelerated heart disease. So the hypertension, the diabetes, the high cholesterol. Those are people who develop heart disease at earlier ages than what's average. But say you have a very strong family history of heart disease. Could be because you have high cholesterol, familial hyperlipidemia or hypercholesterolemia, or the way your body handles that cholesterol and the profile of cholesterol is abnormal. So nothing you have done has led to it, it's just your genetics, and that could increase your risk for heart disease.
So you don't advocate for sauce on Saturdays?
No.
The sauce is boiled
So-
pork and cucumber.
Pork is a very fatty meat.
We're
And
using the lean, pure lean.
okay. And then, of course, there's the cucumber with lots and lots and lots of salt. And of course, you might speak of.
You need salt so that you don't cramp up.
You do. We
Mhm.
all need sodium in our.
Exactly. You can't cut it out completely.
But we're talking about the degree. So, and I'm glad you raised that point. So, especially in our population, excessive sodium is one very common cause of hypertension. And we have a genetic predisposition in
Yes.
Barbados and in the Black population, in that, post-slavery population, for retention of sodium and retention of fluid. And it is really striking sometimes how, especially my patient, if they're good about restricting their sodium intake, their blood pressures come down to normal. It's sometimes miraculous. Or patients with heart failure can sometimes push themselves into exacerbation and end up in hospital by a single salty meal.
Wow.
Yeah. So yes, we need salt. We need cholesterol. We need fat in our diets. We need sugar in our diets, or carbohydrates in our diets. But it all
In
boils
moderation.
down to how much.
Yeah. And obviously, after you've had a heart attack or stroke, you do need some type of rehabilitation.
Yes.
How critical is rehabilitation?
And rehabilitation is vital. So let's talk about heart attacks. So, you've come in with your heart attack, you had your blood vessel opened up, I take you to the cath lab and put a stent in your blood vessel. We put you on all the good medications. We're now at the point of secondary prevention. So all we were talking about before with healthy lifestyles, before you had the heart attack, that was primary prevention. Now you've had a heart attack. We want to do secondary prevention. We want to prevent this from happening again. So again, we go back to, healthy lifestyle, etc. And one of the things that we do here is this cardiac rehabilitation program where there's a heavy emphasis on secondary prevention, on getting people who've never really been in a gym before in their life to get on a treadmill and experience the joys of exercise. They meet with a nutritionist and look at what their diets are like and identify where the problem areas are. They look at, how their lives are stressing them out and what they can do to improve their psychosocial aspects of their health. Do they have sufficient family support? Do they have, and is the environment around them sufficient to encourage them to lead that healthy lifestyle? And of course, part of what we do in rehab is look at their medication and make sure that they're, on a cholesterol medication when they had a heart attack, or, that we do blood pressures every time they come into the gym to make sure that their blood pressures are in an even keel. And if they're not, or their blood sugars, we send back letters to their doctors saying that, well, this is what your patient is doing. You may want to take a closer look. The evidence is there that patients who do that 3-month period of cardiac rehab not only end up in hospital less after their cardiac event, they actually live longer. Patients who've had stents, patients who've had heart surgery, patients who have had a heart failure, hospitalization, all of these subsets of heart disease are patients who actually have a mortality benefit from coming to cardiac rehab.
So I'm eating healthy all the time, sauce at least once every 3 months. We can agree on that.
I'll give you that.
I thank you.
It doesn't have to be pork sauce either.
Well, no, that's the only sauce I recognize. Dr. Scantlebury, thank you so much for chatting with us. I really appreciate you taking the time out.
You're welcome.
That was Dr. Donna Scantlebury, the interventional cardiologist and medical director of the Cardiac Disease Prevention and Rehabilitation Program here at the Heart and Stroke Foundation. Stay with us, still a lot more to discuss here on One-on-One.
All of our emotions, reactions, and behavior start with a thought. I'm Krisnan Hurdle, clinical psychologist and certified life coach. When we are confronted with a situation, the stimuli we receive from the outside is matched up to information, knowledge, and beliefs we have stored in our minds. This creates an emotion, and then a behavioral response follows. The information we have stored as our memories, beliefs, attitudes, and our trauma shape our outlook on situations and our responses to situations. It is therefore necessary to detox, to renew, and to train the mind. Be careful what you put in and pay attention to what comes out. Take control of your mind and take control of your life.
Keep it clean, keep it green.
Barbadians, we invite you to get involved and play your part as we clean and green Barbados. Come into your community with media launches, bulk waste collection exercises, community engagement sessions, and giveaways. Get on board. Let's keep Barbados clean and green.
Beautiful, beautiful Barbados.
Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another, get vibration. Develop emergency community plans so that we could function. Remove outdoor objects. Make sure that you went to the ATM. Stock up with water. Make sure you clean the guttering. Lord, what about canned food? Make sure you got some stock up in your room. Make sure you prop up the paling and tie down the roof. Let me start to prepare real soon. Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another is equation. Develop emergency community plans so that we could function.
Welcome back, and we're joined now by none other than the lady responsible for the effective running of the Heart and Stroke Foundation of Barbados, Inc., the Chief Executive Officer, Miss Michelle Daniel. Miss Daniel, thank you so much for joining us on the program.
Thank you, Lisa.
Now, let's talk about the foundation in terms of looking at its history. It was actually formed back in 1985, but at that time, it was actually just known as the Heart Foundation.
That is correct. And then in 2006, they joined Stroke, and it became the Heart and Stroke Foundation of Barbados, Inc. And so that's where it started in terms of the importance of recognizing the importance of heart and stroke, cardiac affairs and stroke affairs in terms of interventions, and needing to address both of those for the public and the nation of Barbados.
And that's your main focus, advocacy, spreading awareness.
I would say spreading awareness, education, advocacy, but also that rehabilitative aspect and prevention. So we are multifaceted. There are many aspects and many arms to the Heart and Stroke Foundation of Barbados.
Do you think that the message is getting across about how serious heart attacks and strokes are?
I would say yes, but there's much more that can be done. I think there's research to show that despite the messaging, whether it's at the global level or the local level, there are some persons who say they don't know the signs of the heart attack. They don't know the signs in terms of a stroke and what to do. And so that's why every year, whether it's right through the year and even specifically during September for World Heart Day and October for when World Stroke Day occurs, that you hear us messaging, you see ads, you see social media activity emphasizing the importance in terms of knowing the numbers, in terms of your blood pressure and knowing the factors that affect, your heart, and in terms of that in terms of the risk factors in terms of having a stroke. So I would say, yes, it's improving, but more can definitely be done.
And in order to do that more that needs to be done, you have several programs here at the foundation. Tell me about them.
So we have our cardiac disease prevention and rehabilitation program, and that caters to persons who have had a cardiac or stroke event. They have to be referred to us either through the public, in terms of the public hospital system, so the Queen Elizabeth Hospital or the polyclinics, as well as private practitioners. And then when they come here, they're actually assessed by our team in terms of our nursing team, and they go through a period. So our cardiac referrals have up to 12 months with us. And then the stroke clients, they have up to 6 months. It depends in terms of their continuity. And after that, some people actually, because they appreciate the program in terms of the fact that we have a nursing team, we have access to nutritionists, that they continue even after their official rehab period is over. And we mentioned rehab, but prevention. And I want the public to know that in addition to focusing on rehab, if a practitioner thinks that a person is at risk of having an event, so whether they have elevated blood pressure, their cholesterol is high, they can actually be referred to us and be part of our prevention program as well. So we need persons to know that. So yes, we focus on after the fact, but also in terms of before, in terms of preventing and the occurrence and helping persons to prevent or avoid the occurrence of a major health crisis. That's one department. Then we have our emergency cardiac care department. And in that department, we focus on life-saving skills. So first aid and CPR for the individuals, the lay persons like us. So, and we think it's important for one person in every household and in every workplace to be able to do the basics until the emergency ambulance services arrive. So that's important for us. That's called the Heart Saver. Just a fee, $150 for our course. And you're certified. You actually your certification lasts 2 years, and then you can be certified. It's important to be sure that you keep current. And then in addition, we focus on the first responders, basic life support. And so that would be the police, the fire service, and other first responders. And then our advanced cardiac life support, which targets the doctors. So there are various levels in terms of resuscitation, life-saving skills, etc. And we are able to provide all of those. You just, you call the office and you can make an appointment and be sure that you have someone that's able, anything can happen. It can happen at church, supermarket, in the workplace. And we think it's really important that persons focus on that training. We have a youth gym. So on Saturdays, we focus on our children specifically. So we have a multidisciplinary program catering to children, I would say officially 8 to 19. But then sometimes we have requests for children under. And that looks at children who may be trending towards being overweight or living with obesity. And that looks at exercise, nutrition, in terms of including practicals and demos for both parents and children. We look at the psychological aspects as well. So it's, as I said, multidisciplinary. And we do activities here as well as offsite. So we might go on hikes, beach training, but the coordinators, we look at having every semester a very structured program so the parents know what to expect as well as the children. And this is an emphasis, and we're very, proud of this program. And we, even though, I would say we want persons to know that it exists, that the children can operate in a safe environment and be happy to actually know that they can exercise and be healthy and still have fun. Headquarters, so it's going to go on. Headquarters, we do our worksite wellness programs. If companies or individuals need presentations done, health fairs. So all of those are services that we offer. You call the office 537-3312 and speak to Mrs. Greta Yearwood, our administrative coordinator. And so if you have an idea in terms of you want to have a discussion on the risk factors associated with living with cardiovascular disease or caregiving seminar or living with whatever it is, and you have the idea in terms of you want that information, because we need the public to understand that we are here to help. We are here to serve the public of Barbados, and we need persons to know what it is that we do. We have our website, our social media handles, and so on. But the fact remains is that we are here. Everybody has a heart is our motto. And so we know that we want persons to have a healthy heart and to live a long and healthy life, to be there for their family and their friends.
I want to go back to the youth gym.
Yes.
How well subscribed is that program? How many children do you have in the program?
Okay. So I would say, let's say pre-COVID, we would have maybe had maybe 70, maybe trending towards 100. It's now going back up. So when we closed just for 2 weeks for summer, just before the school term commenced, we were at maybe 56, 58, and we have had new referrals. I would say maybe now we're maybe about 70, and they're categories. So on Saturdays, they're actually divided into age groups in terms of management. So 8 to 11, 8 to 10, 11 to 13, and then those above to the upper range. And, activities organized in terms of, I would say, in line with their age, in their age range, and in terms of managing in terms of group size. So yes, it may be, for some, it may be disturbing in terms of saying that we have that number of persons, but the fact is there is a space where the parents can feel comfortable. We have Professor Margaret Ann St. John, who is a well-known pediatrician. She's also our medical director for youth programs, and she pays close attention in conjunction with those of us who are on the ground in terms of the coordinator, the fitness expert, etc., to ensure that the program is well organized. Actually, herself and a former CEO, Mrs. Gina Pitts, were the ones who were instrumental in introducing the Youth Gym program to the Heart and Stroke Foundation a number of years ago.
And obviously, I wanted to focus on that specifically because if you get the problem corrected early, then we reduce the amount of heart attacks and strokes we see.
That too, but also we need healthy children, because the healthy children, if we have them healthy, if they exercise proper nutrition practices, then they will become healthy adults, because those are the ones who need to lead, who need to be in positions, and we need them to be healthy to be able to function effectively. And so that's why in the public spaces, you will hear us speaking and frequently in terms of overconsumption of sugary beverages or sugary sweetened beverages. And that part in terms of advocacy, because our childhood obesity prevention program, which is a special program under the arm of the Heart and Stroke Foundation, actually focuses on that. We have our 6 model schools. We interact with the other civil society organizations. There's a coalition which looks at childhood obesity prevention. So the Youth Gym is a bespoke program under the Heart and Stroke Foundation. The childhood obesity is, I guess an umbrella, with a wider remit in terms of a national remit, but together we work in terms of trying to save the lives of our children in Barbados.
And I know the foundation was happy to see that the tax on sweetened beverages increased substantially.
Yes, sir.
You were
10 to
advocating for
20,
that.
we were advocating for that. That was a major win for us. And also recently, the school nutrition policy,
Mm-hmm.
in terms of seeing that actually being on discussed. Yes, they need to do implementation. It's one thing to have the policy mentioned and tabled and, I guess, passed. But then the action in terms of actually, whether it's marketing to children in schools and the various aspects, to actually see that mobilized and made real in terms of tangible, actually executing effectively. Yeah.
Now, you are a non-governmental organization,
That's
which
correct.
means that you rely heavily on donations.
Mm-hmm.
Let's look at where you are in terms of donations, how COVID impacted the foundation, and then getting volunteers, because you are supported a lot by volunteers as well.
Yes. Thank you so much, Lisa, for that question. So, like the whole of Barbados, the whole world, we were impacted, had to close. And of course, at the time, we would obviously have our clients in terms of,
Yes.
especially our high risk clients.
Mhm.
And so we were majorly impacted, but we had to then kind of pivot quickly. Obviously, we were all derailed. But what that allowed us to do, even though for a time we were not allowed to open until such time as we were classified as a health quasi healthcare facility, that telehealth, we kind of try to do telehealth, keep especially the high risk, because we have high, medium, and low risk clients in terms of under the CDPNR. And so we try to keep them engaged in terms of, the nurses making telephone calls, try to do exercise in terms of, the Zoom and utilizing that, those media to actually maintain contact, because even though we were closed, we had to ensure that there was continuity of service, because we provide that important service. We couldn't do rehab in the traditional way, but we had to ensure that there was contact. And so, of course, no fundraising. Our last major fundraiser prior to September last month would have been March 2020, when we'd have had our Different Strokes polo event. And so then after that, nothing. So then we now have to go through in terms of, whether it's grant funding, in terms of enlisting the support of our regular benefactors, as well as new persons, because we are a nonprofit. Yes, we are, and we do a lot of things, but we have to do them in conjunction with others, in conjunction with partners. There's so much that can be done. Sometimes we have persons who, may want to do rehabilitation, but may not necessarily be able to continue. And so it's important. So I don't think, I can only give X amount, but every little bit counts. And so we value all of our benefactors, all of our donors, those persons who support our fundraisers, as well as help with sponsorship. And so we were impacted immensely, and we look forward to, we turned the corner. We had a charitable luncheon for World Heart Day in September. And I just want to say thank you to all those persons who supported. And now it's time for us to continue to be able to offer the services that we need to the various, because we have a wide range of stakeholders and clientele, and we need to reach those persons to be able to make a difference, whether it's through educational seminars, whether it's through community events in terms of outreach activities. Whatever it is, we are here to serve. We want to reach the public.
And speaking about wanting to reach the public, how
Yes.
does the public reach you? If I wanted to become a volunteer, if I wanted to, benefit from your services, how do I reach the foundation?
Okay. So actually, one of the best places to actually get information on our website is with loads of information. So www.hsfbarbados.org, that's our website. You can call us at 537-3312. The Miss Gill will transfer you, and then, as I said, Mrs. Rita Yearwood, our administrative coordinator. If you want to get any additional information, if you want to become a member or a volunteer, Mrs. Yearwood will be able to help. And let's speak about volunteers, as you asked a few minutes ago. Small office, doing a lot, and we value our volunteers. We have some persons who volunteer in terms of supporting our stroke program, for example, occupational therapists, speech therapists. Those are simple examples. But then now, in terms of fundraising activities, in terms of when we want to go out and do a health fair or health activity or showcase, it's important that we actually have persons to support us. You may only think, I only have an hour. An hour a week can make a tremendous difference in terms of your area of expertise. We always say, bring your time. You don't have time. You may have a talent that you can share in some way. And of course, then in terms of treasure, so time, talent, treasure. and we value whatever persons can give, because as a non-governmental organization, we do need the support of others. We do need other hands. Many hands make light work. And so we are always appreciative of persons who come to us, whatever they have to give, whatever time they have to give. It will make a difference.
Well, Ms. Daniel, we value all that you and your team are doing here at the foundation, and thank you so much for sitting and chatting with us today.
Okay. Thank you very much, Lisa. It was my pleasure.
You're most welcome. Now, that was Ms. Michelle Daniel, the Chief Executive Officer of the Heart and Stroke Foundation of Barbados, Inc. I am Lisa Lord. You are watching One on One. Do have yourself a wonderful evening.